This video is part 3 to the sports hernia virtual surgery. If this is your first time joining us, please go back to part 1 and see also part 2 before moving into this video. The goals of the video today are going to be going over continuing to challenge the posterior chain and adding more frontal plane exercises, as well as adding in more of that anterior chain, which is the area that was a part of this injury. So we want to go easy on this and slowly build you into that. Remember, we're at week 5, so go back if you're just joining us now. As I've mentioned at the end of part 1 and 2, cardio is a part of this, so please continue walking. If you are tolerating biking, elliptical, something a little bit more cardio-based, please continue to do that this week as well. The exercises I'm going to go through are actually a really great way to build in circuits. So I'm going to show you 1, stick around for 2 and 3, and then circle back around to these exercises, rewind the video, and come back to take yourself through maybe a 2 to 3 set circuit of them. Okay? Actually, I'm going the wrong way. Yeah. So the first exercise here, okay, we're going to lay down on the floor, all right? And we're going to make a diamond with our hands here, elbows wide, and the diamond is at about the level of your forehead, okay? What we're going to do is, as always, start to breathe deep into the belly. So in this new position, we're going to start to push the floor away with our breath. And we're going to stay stiff when we let that breath out. Notice that your back doesn't sink back to the floor, so practice this a little bit first, okay? Then from here, what we're going to do is use our elbows, okay, where you feel the inner part of your elbows and the floor meet. I want you to push down into the floor to let the head raise away from the carpet here, okay? Go as much as you can tolerate and continue to breathe deep into the belly. See if you can get a little bit higher, okay? And then see if you can start to peel that belly button up off the ground a little bit. Find the place maybe where you start to shake and breathe, and then slowly lower. So take yourself through those steps slowly, only go as far as you can tolerate. Again, using the elbows, raise the head and the face away from the floor like something is really stinky. Okay, breathe deep into the belly button and see if you can lift that belly button up off the ground. Hold, breathe, and slowly control it down. Try that for 5 to 8 reps and then move on to the next exercise. The next exercise is a side bridge, okay? I'll show you the bridge version, then I'll show you the plank version, and you can do whichever one is the most challenging but tolerable for you. None of these should be painful. Again, if you're still having a lot of pain and discomfort during these exercises, you might need to regress to old videos or click on the link for our sports hernia recovery plan to check out more information about this injury. Setting up on our elbow directly under the shoulder here, not sinking towards the floor, but find a nice neutral spine. We're going to breathe into this top side here. We're going to push through the knee, come up into a bridge, belly button or belt buckle to the camera, hold, breathe. I'd go for about 5, maybe 10 breaths here. Hold to a challenging amount, maybe push the floor away a little bit more. You should feel the side body working, maybe a little bit into the side hip as well. Sometimes people's shoulders are a limiting factor here, and that's okay. And then we're going to sit back like we're sitting into a chair to take a break, okay? We're also going to switch to the other side. On this side, I will show you a side plank. So what we'll do is you can start first, extend the top leg, keep the bottom one bent as well. Again, tunnel, breathing, lifting, 5 to 10 breaths, belt buckle forward. Or from both feet, I like to stack the top one in front of the bottom one. Lift, belt buckle forward, breathing deep into the sides, feeling the side body on the downside working. Sit back into a chair to take a break. Repeat that about 3 times to a challenging amount. Move on to the next exercise to complete the circuit. Okay, in this exercise, we are then now going to start to challenge that front abdominal wall a little bit more. So as always, finding your neutral pelvis and your breathing first. Take your time finding that. We're going to bring our legs up to about 90 degrees, okay? You can come here. I like to come a little bit higher if your groins can tolerate it, and the feet a little bit higher as well. As long as you can breathe and control in this position, let's take the hands away. Now we're in our dead bug, okay? From here, we're going to start to rock a little bit. The idea here is, can we control rocking as one unit? Okay, we don't want any crazy excessive twisting motions. We're going to breathe, and we're just going to see if we can roll, again, as one unit. My hips and my shoulders are locked into place. Most people say, what do I do with my head? Whatever feels right for you. You can lift with, okay, or you can let it roll on the floor. As we get into this, we're going to see if we can get a little bit further. Here and here. And the next progression to this would be, can we get up? Okay, so from here, push through the elbow. This looks like a familiar position. Press up into our 90-90 at the hips and knees. Come on back down, reverse that. And then rock and roll to the other side, up and back down. Okay? Again, trying your best to move as one unit. Do not push yourself into any positions that don't feel right for you. Regress the exercises or check out the recovery plan if there's pain and you need to know why. So for this next exercise is very similar to our side plank we just ended on, but now we're going to start to challenge that inner thigh muscle here. Again, some of you may not be able to tolerate this one, so the amount of effort you put into it can be dialed back or it can be dialed up depending upon what you can tolerate here. So we're setting up into that neutral spine, we're breathing deep into our belly, and what we're going to do is now not using the front leg, but the back knee, we're going to drive it down into the floor to lift, to hold. Okay, if this is too much, let that front leg help you a little bit, okay? And then come on back down. Or what you can do is just put pressure into the floor but don't lift. Maybe about 30 effort, 40% effort, 50. Grow, grow, grow until you can tolerate getting up into that side hold. Breathe and control it down. Switch to the other side. See if you can do about 2 to 3 sets of that. You're probably not going to hold for long, 2 to 3 breaths. Go back to circuit or go back to the beginning of the circuit. Try that first exercise again and repeat. There is one more part to this series. Congratulations on making it this far. Part 4 is going to pop up on the screen. Take advantage of that if you are ready to progress. Go back to part 1 and 2 or stay here on this video for a little while until you feel ready to progress forward.